Good evening. The big story we continue to track, the second surge in COVID cases across the country now, a matter of huge concern. We'll bring you all of the details. Now, 28,903 COVID cases is the latest number. That's the highest since the 11th of December. There have been 188 deaths in 24 hours, and that number of 28,903 is a 24-hour number. So that's extremely high. Quite clearly, the curve is going up once again. 84% of the new cases have been reported from 6 states, with Maharashtra at 17,864 cases, very much on the top. And there are now some reports suggesting that hospital bed availability, particularly with ventilator facilities in Mumbai, is becoming a bit of a challenge. That's what we have at this stage. So therefore, the big question that we continue to ask, is it time now for India to vaccinate as many citizens as possible, not just those above the age of 60 and those above the age of 45 with comorbidities? Joining us for more on that, Kiran Shaw. Thanks, ma'am, very much for being with us. A lot of people would say that we delayed the process of actually opening this up for those above the age of 60 and those above the age of 45 with comorbidities. Do you believe that we are actually delaying the process of opening up vaccination to a larger segment of our population?
You know, Vishnu, I've always said that, look, the first phase was very important for us to follow the whole process of vaccinating frontline healthcare workers and essential workers in a staggered way, because we needed to understand the rollout in terms of efficiency and safety. When it comes to the second phase, where we've actually opened it up to the 60 above 60 years and the comorbidities above 45 years of age, I think now onwards it has to be parallelly done. You've got to parallelly vaccinate phase 2 and phase 3, because only unless you do that, you will not be able to really cope with this surge. I've been saying that for the last 1 month, saying, please try and start opening it up to the general public. Because, today, I think there have been additional classifications of teachers and judges and, NGO workers and a few others who have been now classified as frontline workers. I don't see why you can't classify the working class, the factory-going working class, the workers in general, and students under this whole category of frontline workers or essential workers, because these are the people who are going to be spreading the disease. I mean, there is warped logic into believing that they are less vulnerable than the municipal workers. After all, they all use public transport. So I think you have to be very, very careful about how you look at this surge, how you look at how you stratify the population. And I, for one, really believe that you ought to, parallel track phase 2 and phase 3 vaccination.
Yeah. And ma'am, I might add journalists as well. For the last 1 year, we've had reporters reporting the worst COVID cases all across the country on the field. They need to be injected with the vaccine as well. But be that as it may, I think, and it's perhaps time to be more direct about this. Every day we get numbers talking about the vaccinations which have been done. X lakh vaccinations have been done, so many thousand in every state. Now that's all well and good, but I think the overall figure is somewhat misleading, because if you look at these as a percentage of every 100 cases, where does India stand? Frankly, we are nowhere close to where we need to be. Therefore, is it not time to understand that these numbers that we keep saying, if you say X lakh people have been vaccinated today, that's not really an indicator or a true indicator of where we should be?
Well, there are many aspects, Vishnu, because 3 things I can think of. One is that even though we were supposed to vaccinate a certain number of people in the phase 1 rollout, we only vaccinated half of them.
Yeah.
Okay? Now, when you look at phase 2, I'm sure you will again find that there is not enough people to be vaccinated, because there is vaccine hesitancy and vaccine skepticism. So effectively, you're just basically vaccinating half the number that you are aiming to vaccinate. And I think, therefore, you do need to roll it out to phase 3 in a parallel tracking way. We know that when you do things sequentially and in a stratified way, it is going to impede the speed of vaccination and the scale of vaccination. So you've just got to get into this mode of parallel tracking phase 2 and phase 3.
Yep.
I also believe that if you look at the numbers we vaccinated so far, maybe it's close to 40 million if you were to really sort of stretch it a bit. But that's not even 2.5% of our population.
No, exactly. That's just the point. You say 4 million, it sounds great, but that's nowhere close to where we need to be. And yet that's the number which people just tend to buy.
Large, not for a country like India.
No, absolutely not. Ma'am, the other point that came out today actually in the Health Ministry press conference, and this is shocking. Now, there's 6.5% vaccine wastage on an average. Andhra Pradesh, Telangana, Karnataka, Uttar Pradesh, right, are the worst offenders. This is ridiculous, absolutely. Each dose, and we were talking about the cost of every dose. When will the dose come out? Do we have enough supply? Should we be exporting? And yet in our country, there's 6.5% vaccine wastage. Some states way higher than the others.
Every country in the world says, look, at the end of the day, if there are any spare vaccines, anybody can come and we'll vaccinate them on the spot. So these are some of the measures people are taking. And I think we actually should start opening up to the general public, like I said. I think we should also stop this appointment booking because that also slows down the process. And I think we should really get into walk-in vaccinations. I think a large number of our big hospital chains are really, fully geared up to deal with large numbers and in a very systematic way. So I think you should combine the appointment booking with walk-ins, depending on how many people arrive for vaccination. People are fearing that if you open it up to the general population, there will be a stampede, but I really don't think that will happen. I think the big, hospital chains are fully geared and are are capable of regulating and organizing things in a much more systematic way.
And finally, ma'am, would you agree that we just don't have the luxury of vaccine hesitancy in this country? We've seen a lot of states in Europe being hesitant on AstraZeneca, but the data out there suggests that there is no direct linkage. There is no direct linkage between blood clots and AstraZeneca, the Covishield over here in India. And therefore, it's just something which a lot of people, the World Health Organization says, that we shouldn't be considering at all. Is this also something that is dangerous if we're trying to save lives? We end up losing lives.
Vishnu, first and foremost, no country in the world can afford vaccine hesitancy. And no country in the world should remove vaccines on such basis. In fact, I think the European countries who have taken these kind of decisions are very irresponsible, if I may say so, to do that. And WHO and the regulatory authority, EMA, is actually saying that there's no link. And yet all these, countries have, stopped or suspended vaccination of the AstraZeneca vaccine, which I really think was unwarranted. India, fortunately, has not gone that way. I think in people's mind, unfortunately, there will be concerns and skepticism about the vaccine. But, let's remember that there is nothing to link it with blood clots. So we should continue with the vaccine program as fast as possible and at scale.
Thank you so much, Kiran Mazumdar Shaw, for sharing those views. It's so important for us to increase the pace of vaccination. Couldn't agree enough. Thanks very much indeed, ma'am.